Hey folks, it's Dr. Franklin, and I'm back again with another presentation dealing with cultural awareness. In this talk, I am going to discuss the importance of cultural awareness within a clinical context. In other words, why is it important within a context in which you have one individual assisting another in reaching their goals? I'm going to talk about some dimensions of culture, and I'm going to talk about some common challenges that are encountered as it relates to culture when helping others. And then finally, I'll end this talk with a discussion of different things you can do to foster your own cultural awareness. So, without further ado, let's get into the presentation. When people discuss culture, they oftentimes will use a metaphor of the melting pot. I heard someone attempt to use that metaphor before, and someone in real time reflected on their experiences in New York and stated, it's not a melting pot, but it's more like a poke bowl. You have people off in their respective corners of the world, distinctly different, but not necessarily mixing together. Perhaps the great American experiment will one day lead to us being like a salad. If you've ever had a salad, which most people have, you will have a bowl with distinct ingredients. If you're anything like me, you'll have some romaine lettuce, because iceberg lettuce has no nutritional value. Maybe some carrots, some radish, raisins, sliced fruit, a dash of strawberry poppy seed dressing, and some croutons because, much like Oprah, I like bread. When you mix together your salad, everything in your salad bowl remains uniquely itself. At the same time, when it comes together, it creates a different taste experience for your palate. Culture, broadly defined, can be thought of as shared beliefs, values, attitudes, practices, and ideologies held by a group of individuals that is often passed down from generation to generation. Culture creates meaning among a group of individuals. It's constantly being produced, it's being reproduced, and it's also being distributed. You can think of culture as being a label for shared knowledge, skills, and attitudes. And because of all of this, it's important to explore on a personal level as well as it's important to explore the culture of your client because you don't want culture rearing its head in a detrimental way. One has to learn about the history and general characteristics of a culture to understand the background and worldview of a person, because to not do so could potentially cause clients to feel distant from you, which could ultimately lead to pre termination of therapy. To not explore one's own culture or the client's culture can place individuals in danger of making assumptions, sometimes based on research one has done on a culture, and this could ultimately lead to offense, relationship strain, and finally, relationship dissolution. Culture includes race, ethnicity, gender, age, ideology, religion, socioeconomic status, sexual orientation, disability status, occupation, and dietary preferences, just to name a few things. The addressing acronym provided by Hayes is a helpful and convenient way to remember some of the components of culture. It's important to note that some cultures require a mission, some cultures one has to be born in, and some cultures are that of a person's choice. Take, for example, Jewish culture. One could be born into the culture as a result of their biological makeup. Then it's the case that one could convert to Judaism and thus be a part of Jewish culture that way. Some cultures may carry more weight than others and may become salient at a particular time depending on the people, place, or situation. Perhaps the fact that I'm an African American is not particularly salient for me at a historically black college or university because I'm surrounded by a majority population of the same ethnic makeup. However, if I am driving and I'm suddenly pulled over by police, my ethnicity may rise to the forefront of my mind as I ponder what interaction is getting ready to take place and how best to ensure the safety of everyone involved. When working with clients, one should consider how they could be processing and coping with oppression related to multiple identities. For example, many Black women often have to deal with gendered racial discrimination. Historically, Black women have been stereotyped as a mammy, which is a nurturing, self sacrificing figure, an angry Black woman, Jezebel, who is thought to be promiscuous and self serving, and a sapphire, which is an individual who is overbearing, aggressive, and intolerant. Not only do Black women have to deal with discrimination based on their status as a woman in employment settings, healthcare, and in religious settings, just to name a few, but they also have to deal with discrimination based on their race. These identities that Black women hold overlap to cause significant distress and turmoil in their personal lives and in many areas of their lives. A helper needs to be sensitive to the plight of people who have multiple identities due to the oppression that one may experience as a result of those identities. Consider for a moment the experience of a Chinese American student during the start of COVID, how many were dealing with being stereotyped as the perpetrators of the COVID pandemic, in addition to navigating challenges that are unique to being an international student. Consider how sexual minority groups, who also happen to be minorities in another stigmatized group, be it religious, connected to disability, etc., deal with oppressive environments in which people in power limit their ability to lead truly free lives. So, intersectionality is important to consider when we're working with clients because identities overlap and identities oftentimes can point to oppressive experiences that people have had outside of the clinical context. Though this may be understood by the listener, it never hurts to mention it because it may heal to mention it. Race is a social construct that was used to subjugate a particular demographic into slavery. When we look at the DNA of man and women of different hues, we do not see any significant differences. From a genetic standpoint, there seems to be more things that unite us than divide us. While race is important to take into consideration when working with a client because it's an aspect of culture, it's worth also thinking through racial identity. Racial identity could speak to where a person is psychologically as far as their views on their race, how important their race is to their identity, and how they expect the outside culture to treat their race. These variables will undoubtedly impact the therapeutic relationship. For example, imagine a Japanese American who views their collectivistic culture as extremely important. Imagine them perhaps disliking someone who is insensitive to their culture, or they may prefer someone that resembles a person from their culture because the underlying assumption there is that said person may be able to relate more. Now, the latter is not always the case. For others, racial identity may represent a developmental trajectory of moving from ignorance, denial, and bigotry to acceptance of other cultures and a willingness to integrate and embrace ethnic and racial diversity. It's also important to think through sexual identity as well. That may be worth considering if it's related to a person's presenting concerns. When moving to a new culture, we sometimes have choices in regard to how we adjust. Some individuals move to a new culture, whether that's joining a church or being a psychology major at an institution or accepting a new job, and they make a decision to hold on to their culture of origin. This is called enculturation. Others, when they move to a new culture, they make decisions to fully take on the new culture and leave the old cultural framework behind. This is called assimilation. Assimilation is seen quite often in the military. One of the first things higher ups stress to civilians during the boot camp experience is the need, and there some would argue there's a demand for them to adopt a more team oriented, collectivistic way of thinking, given the dire circumstances that enlisted active duty soldiers find themselves in as they strive to protect the U.S. in various ways. A shedding of old ways of thinking becomes critical for the person joining military culture. There are various ways in which individuals may react when entering a new culture. They could disavow their allegiance to the culture they are entering and make a decision to retain their own culture. Then there could be individuals who engage in marginalization, in which they reject the new and the culture from whence they came. Determining what the acculturation process looks like for individuals who are first generation or second generation immigrants could be really helpful when considering the various factors that are impacting someone's functioning. Egalitarianism could have implications for what clients expect from their helpers in session. If people are from cultures with more hierarchical structures, then those individuals could have expectations that the helper is going to proffer advice and provide direct guidance in regard to their situations. For someone who is accustomed to more distributed power and is from an individualistic culture, then they may value the therapeutic space for processing out their feelings and concerns and subsequently coming up with their own solutions to conundrums and issues they are encountering. Culture may dictate what an individual expects within a clinical context. It's also worth considering the extent to which the person you are assisting is from a culture that values spiritual considerations versus a culture that finds importance in scientific evidence. This is important because the interventions used should be largely based on what the client needs. For example, you could have an individual that wants evidence based treatment for their social anxiety. They want to practice role playing, being assertive, and deep breathing because the research literature speaks to that being effective. In turn, they may overtly or subtly indicate that they are not interested in discussing spiritual factors that are connected to their social anxiety, or the idea of prayer and the usage of doctrine may be something that they do not want. So, while a helper may want to use those things to assist a client, it's clear that it would be contraindicated because it is not what the client would prefer, and moving forward could cause the client to be resistant or drop out of treatment altogether. It's also worth thinking through how gender role differentiation could affect how treatment engagement looks in a helping context. Someone from a culture that values being manly and showing little emotion or vulnerability might find it challenging to explore emotions and thoughts in therapy if so much of their lives outside of the therapeutic space is spent projecting a stoic presentation. So, a helper that is sensitive to the person's plight will be more poised to understand them, communicate said understanding, and facilitate their growth. Finally, tight and loose cultures are differentiated by the amount of rules and restrictions they have for their citizens. There are tight and loose cultures within the US, as identified by states, as well as tight and loose cultures internationally, identified by different countries and continents. Others have even noted upper class individuals are associated with loose cultures. Lower class individuals often deal with more restrictions and rules governing what they can do. So I'm just laying out for you all a bunch of cultural factors to consider when working with clients. And of course, all of this is going to be respective of what the presenting concern is. So if the presenting concern is tied to tight and loose culture restrictions or gender role issues or issues with discrimination, then it may make sense to do an exploration in regard to those specific cultural elements. We will not always get it right. Many scholars and educators argue that it's not a matter of if you will offend someone from a cultural standpoint, but it's a matter of when. What do you do when it happens? This isn't to say that you should avoid efforts to explore biases and prejudices that we have and explore how that affects people you encounter. It doesn't mean that one should rest in hopelessness and shift blame or onus for uncomfortable situations that have cultural dimensions to others and their sensitivity to offense. Rather, it means that one commits to a lifelong process of cultural humility and growth that is expected and ethical of a helper. One should strive to do research on the cultural background of those that they work with, and at a moment's notice be willing to abandon what they've read about or seen based on authentic experiences presented to them. And they also want to make sure that one does not forget the commonalities that unite us all, the need for basic needs to be met. When power differentials show up in therapy that the helper suspects is affecting the helping relationship, the onus is on the helper to have conversations about it. If the helper does not take the responsibility of initiating the conversations, then these things will go unexplored and yet continue to affect the relationship. This includes differences in age, race, and ethnicity across the helper and client if this seems to be affecting the relationship. This also includes relationship status markers like marriage or divorce or any other relevant variable that the client may have an issue with. Again, it's not necessary to broach conversation about race if it has no relevance to the presenting concern. However, if, for example, someone is coming into session to discuss concerns they have about their Palestinian child being born in America during the Israeli and Palestinian conflict, and what that could mean for that child growing up in the States, and the therapist has an Israeli background, then it would make sense for that Israeli helper to ask that client about their experience interacting with them in session. After all, the client of Palestinian ancestry could be thinking that no one would understand their plight, definitely not an Israeli. Or they may be pleasantly surprised at how open and willing the helper is to having a conversation about the conflict and how it affects them and how it would affect their child. Nothing faced can be fixed. Processing openly the client's experience can lead to a stronger bond, more collaboration and agreement on tasks that will meet goals, and it can lead to increased client satisfaction. So, how much do you disclose about your cultural identity when you are working with others? That is truly a judgment call that should be contingent on what the client needs and not one's own wishes. For example, if a client is talking about difficulties surrounding coming out about their sexual identity and a helper realizes that the identity does not align with their own, then they may offer a disclosure about their identity and then posture themselves to receive feedback from the client about how valued they feel in the space given the cultural difference. The conversation does not need to be forced. The important thing is for the helper to avail themselves to have conversations about aspects of culture when they notice differences that are tied to presenting concerns. Additionally, helpers may want to think about what they unintentionally disclose by way of passing remarks, artwork in their offices, attire that they are wearing, etc. If I'm working with someone who is a sexual minority, and in my office I have pictures of my wife all around with us in an intimate embrace, then unintentionally that is disclosing to the client my status as it relates to an important aspect of my identity and could affect the relationship depending on how the client is perceiving my heterosexual identity. It could be that in the past they've interacted with therapists that were heterosexual and they felt very misunderstood. So this could very quickly put me in a disadvantageous situation that wouldn't ultimately help the client, nor would it be true to my values. So it helps to consider exploring different aspects of identity if you think it is related to the client's presenting concern. Some cultural identities are hidden, whereas others are rather obvious because of skin color, artwork, language used in conversation, remarks made, etc. So clients may be pre-screening therapists for things that are important to them culturally, and it is overall very important to have an awareness of possible differences and similarities that are arising within that therapeutic relationship. So, how do you expand your mental horizons as it relates to culture? On the slide are a few activities you can engage in to educate yourself about different cultures. It's pertinent to not expect your clients to educate you on culture. While they may provide insight regarding the culture to you in a way that helps you understand them and help them in session, they are not a spokesperson for their culture, nor are they being paid for teaching a 3 credit hour course on their culture. With the client, your questions are anchored in understanding their experience and what they need germane to what is being discussed. Outside of sessions, however, you are welcome to explore and couch what you find out with real interactions from people of the culture. It's not expected that you will be an expert on all cultures. That's impossible. And it's also possible to encounter cultural challenges while working with someone that is within your culture. But openness to learning and realizing that most clients that need assistance care about matching with someone that has similar values, maybe not necessarily race or gender, is important to take into consideration when working with others. Cultural competence is less about arriving at the port of destination and more about the sail. If you commit to the process, you will not have to sell yourself to anyone you assist.